All right, let's talk about something that can be pretty confusing, your liver function test results. We're going to put on our detective hats today and figure out what all those numbers really mean. So let's just dive right in.
So, you know that feeling, right? You get that notification from your doctor's office. Your lab report is back. You open it up and boom, some numbers are flagged, maybe in red. It can cause some serious anxiety for a lot of people. So, what's the deal with these numbers? What do things like ALT, AST, and ALP, what do they actually mean?
Okay, and this is maybe the most important thing to get your head around right from the start. An abnormal result? It is not a verdict. It's not the end of the story. Think of it as the very first clue in a medical investigation. It's the breadcrumb trail that tells your doctor, hey, start looking over here. It's what kicks off a totally logical, structured process.
All right, so to kick off this investigation, we've got to understand our main tool, right? So what exactly is a liver function test? Okay, so here's a great way to think about it. Your liver is like the main factory for your entire body, right? It's processing, well, everything. A liver function test, or LFT, is basically the quality control report from that factory. Now, here's a key point. It doesn't really measure function like you'd measure a car engine's performance. It's not about horsepower. Instead, what it's really measuring are these tiny enzymes that can leak out of liver cells when they're under stress or get damaged.
Now, any good detective will tell you, you can't just look at one piece of evidence, like the lab numbers, in a vacuum. No way. The very first step is to gather all the background information. You got to interview the key witnesses, and in this case, that's you. And then you have to examine the scene, so to speak.
And this process really breaks down into two main parts. First up is the interview, and that's a deep dive into your whole medical history and your lifestyle. Then comes part two, examining the scene. And that's all about the physical exam, searching for any physical clues.
This history part is absolutely crucial. I mean, your doctor is going to ask about the obvious stuff, like any abdominal pain. But they're also looking at the bigger picture, things like obesity or diabetes. And what's really important here is just how thorough this has to be. They need to know about all medications. And I don't just mean prescriptions. We're talking over-the-counter stuff, even herbal supplements. Because you'd be surprised what can affect the liver. And yeah, of course, things like alcohol use and your travel history are also huge clues in this first step.
Okay, next up is the physical exam. Now, the doctor is literally searching for visible clues. Jaundice is a big one. That's the yellowing of the skin and eyes, a classic sign something's up with the liver. But they're also on the lookout for more subtle stuff, signs that point to maybe a longer-term issue. Things like palmar erythema, which is just a fancy way of saying redness on your palms, or something called ascites, which is where fluid starts to build up in the abdomen. All right, so we've got all our background info. Now we turn to the lab report itself. And this, my friends, is where the real detective work begins. Because a good doctor isn't just staring at one high number. Nope, they're looking for patterns. And generally, these abnormal results fall into one of two main buckets, or patterns. You've got the hepatic pattern, and you've got the cholestatic pattern. And figuring out which of these two paths the clues are pointing down, well, that's the key to cracking the case and narrowing down what's really going on. So let's go down that first path, the hepatitic pattern. And yeah, just like the name sounds, this one points directly to a problem with the liver cells themselves. When we see a hepatic pattern, it means there's some kind of direct injury or inflammation happening to the hepatocytes. Those are just the main workhorse cells of the liver. And the big flashing neon signs for this pattern are high levels of two specific enzymes, ALT and AST. So how do we tell these two apart? ALT and AST, they're often just called transaminases. But here's a super handy trick to remember the difference. For ALT, think of the L. L is for liver. It's way more specific to the liver. Now look at AST. Think of the S. S is for striated muscle. That's because you also find AST in your heart and your skeletal muscles. So a high AST could be a clue about the liver, or it could be something else entirely. And this is so cool. The really crucial clue isn't just that these numbers are high. It's how they relate to each other. The ratio between AST and ALT can be a huge giveaway. For instance, if that ratio is less than 1, meaning your ALT is higher than your AST, that often points towards something like non-alcoholic fatty liver disease. But if that ratio is greater than 2, where the AST is more than double the ALT, that is a very strong clue pointing towards alcohol-related liver disease.
Okay, so that's path number one, the hepatitic pattern. But what if your ALT and AST are pretty much normal, or maybe just a little bit up, but some other number on the report is way out of whack? Well, that leads us right down our second path, the cholestatic pattern.
This pattern is all about something called cholestasis. And that's really just a technical way of saying that the flow of bile from your liver is getting slowed down or even blocked. So the main clue here isn't ALT or AST. Instead, the big red flag is a major jump in an enzyme called alkaline phosphatase, or ALP for short. And that tells the detective, hey, the problem might be in the plumbing, the bile ducts.
But wait, there's a twist. Just like AST isn't only in the liver, ALP isn't either. You also find a lot of it in your bones. So if your ALP number is high, the next critical question for our detective is, where is this coming from? Is it a liver plumbing problem or is it a bone problem?
And here's how they figure it out, and it's actually pretty brilliant. They look at another enzyme called GGT. It's simple, really. If both your ALP and your GGT are high, then the source is almost definitely your liver or its biliary system. But if your ALP is high and your GGT is totally normal, bam! The investigation pivots and points straight towards your bones as the source. It's just a really elegant and clever piece of medical detective work.
So let's say it is coming from the bone. What does that mean? Well, ALP is a marker for how active your osteoblasts are, and those are the cells that build new bone. So a high level might point to something like Paget's disease, which is a condition where your bone rebuilding process gets a little chaotic. Or it could be a sign of osteomalacia, which is a softening of the bones that's often tied to a big-time vitamin D deficiency.
Of course, sometimes the clues aren't so neat and tidy. You don't get a clear pattern, just one single number that's off. Like, what if only your bilirubin is high? Well, if the rest of your blood count is normal, it's likely just a harmless genetic thing called Gilbert syndrome. But if your hemoglobin is low at the same time, it might mean your red blood cells are breaking down. Or what about a high GGT all by itself? That one's often pretty nonspecific. Could be related to alcohol or even some drugs like NSAIDs. But if it stays high, it definitely needs a closer look.
Okay, so our detective has identified the pattern. Is it hepatitic or cholestatic? They've gathered all the background clues. What happens now? What's the next step to confirm their theory and finally solve this puzzle?
This is where the follow-up investigation begins, and it usually involves two big tools. First, something called a chronic liver disease screen. This is basically a whole new panel of very specific blood tests. They're looking for the usual suspects: hepatitis B and C, genetic conditions like hemochromatosis, that's an iron overload, or Wilson's disease, which is a copper overload, and a bunch of autoimmune conditions. The second big tool is a liver ultrasound. This lets the doctors literally see what's going on. They get a picture of the liver structure and all its plumbing. And one last thing. Doctors often use these clever scoring systems to help figure out the level of risk. A really common one is the FIB4 score. It's just a simple formula that plugs in your age and a couple of your lab numbers. And if that score comes back above a certain number, say 1.45, it's a flag that suggests a higher risk of liver scarring, which is called fibrosis. And that result would probably lead to a referral for a special kind of scan called a FibroScan, just to get a much closer look. So if there's one thing to take away from all of this, it's this. Your lab report is never, ever the final word. It is not a verdict. It is the start of a conversation with your doctor. It's the first clue in an investigation that's all about keeping you healthy. So the real question is, what conversation is yours about to start?